Hello, my name is Cody Blaylock, and I am doing my presentation on Streptococcus pneumonia. Streptococcus pneumonia was first isolated in 1881 by Louis Pasteur in the saliva of a patient infected with rabies. Bacteria was first reported in 1883 when the association between the bacteria and lobar pneumonia was made by Friedlander and Tolleman. Attempts at a vaccine were started in 1911. However, the first pneumococcal vaccine was licensed in the United States in 1977, and the first conjugate vaccine was licensed in 2000. Streptococcus pneumonia are gram-positive ovoid-shaped bacterium. They can appear as diplococci, single cocci, or in short chains. The cells are surrounded by dense capsules. The capsules are responsible for phagocytosis resistance and serological differentiation. There are at least 90 different serotypes, but infection in humans are due to only 23 variations. These capsules also inhibits removal by cilia by manipulating the way immunoglobulins recognize the bacteria. Streptococcus pneumonia have a gram-positive cell wall, which that means that they contain many layers of the peptoglycan. This makes the cell wall thick and rigid in form. The gram-positive cell wall also contains teichoic acids. The makeup of the gram-positive cells is why they retain purple dye in the gram stain test and test positive. Pneumolysin is a toxin released by the bacteria that can form pores in cell membranes. It is toxic to the host cell and is released during cell lysis. Pneumolysin can reduce the ability to clear mucus by aiding in the formation of biofilms. It causes inflammation by regulating the production of cytokine and chemokine, which results in a higher rate of transmission of the bacteria. Autolysin is an enzyme responsible for lysis of the bacteria, releasing pneumolysin and teichoic acid that helps promote colonization in nasopharyngeal cells due to the release of the toxins. Pneumococcal surface proteins are proteins located on the surface of the bacteria, and they aid in adhesion to the host cell and work against the immune system. Lipoproteins are responsible for the transportation of substrates. These proteins aid in adhesion and invasion of the host cell and are also needed for full virulence of the bacteria. Immunoglobulin A1 protease is an enzyme produced by Streptococcus pneumonia. This enzyme breaks IgA1 antibodies into fragments, and this prevents killing of the bacteria by the antibodies. Hydrogen peroxide is also secreted by Streptococcus pneumonia. It causes damage to the host cell. Hydrogen peroxide can also be used to destroy competing bacteria. It is also pro-inflammatory and releases cytokines. Streptococcus pneumonia creates biofilms. These are extracellular matrices of polysaccharides. These biofilms aid in bacterial survival in non-ideal environments by creating a protective barrier for the bacteria. These biofilms also increase antimicrobial resistance and ineffective mucociliary clearance. Streptococcus pneumonia also have pili, which are hair-like structures on the surface of the cell that aid in attachment and colonization of the bacteria in the lungs and nasopharyngeal area of the host. Streptococcus pneumonia is non-modal. This is the diagram I drew of Streptococcus pneumonia. This is the multi-layered gram-positive cell wall, meaning it has many layers of the peptoglycan. This is the capsule I drew that the Streptococcus pneumonia forms. This is the hydrogen peroxide. You can see some of the other components that we just talked about, the pneumococcal surface protein, autolysin, pneumolysin, and then here are the pili. Streptococcus pneumonia is found in the human upper respiratory tract, most commonly the nose and throat. It is a facultative anaerobe, which means it can grow with or without oxygen. It does grow best at 35 to 37 degrees Celsius with about 5% CO2 present. It can be cultured on a blood agar plate. This is a differential media containing 5% sheep blood. This plate tests the production of enzymes that lyse red blood cells called hemolysins. Streptococcus pneumonia are alpha hemolytic, which is partial hemolysis and shows a green zone on the blood agar plate. It can also be grown on a chocolate agar plate. This is a variant of the blood agar plate, but the red blood cells on this plate are lysed during preparation. Tests that can be performed to identify Streptococcus pneumonia are the gram stain test, the catalyst test, the optogen test, and the bile solubility test. The catalyst test tests for the enzyme catalase that breaks down hydrogen peroxide into water and oxygen. If catalase is present, the formation of bubbles will be visible. Streptococcus pneumonia is catalase negative. The optogen test tests for sensitivity to the chemical optogen. A disc of oxygen is placed onto the media, and if the bacteria is sensitive, a zone of inhibition will form around the optogen disc. Streptococcus pneumonia is sensitive to optogen. In the gram stain test, the Streptococcus pneumonia are gram-positive because of the makeup of their cell wall, having multiple layers of the peptoglycan and retain the purple dye used during the gram stain test. The bile solubility test is a test used to distinguish the Streptococcus pneumonia from the other types of alpha hemolytic streptococci. In this test, bile salts are added to one test tube, while saline is added to another test tube. The tubes are incubated and checked for clearing of turbidity, which indicates the bacteria is bile soluble. Since Streptococcus pneumonia is bile soluble, it can be distinguished by the clearing of turbidity. I kind of put an example of each of these tests up here and how they look when they test positive. One of the diseases caused by Streptococcus pneumonia is pneumococcal pneumonia. I actually have a lot of experience with this. I'm currently a full-time respiratory therapist at Mission Hospital, so I've seen a lot of patients with pneumococcal pneumonia. The Streptococcus pneumoniae is responsible for 80% of bacterial pneumonias. Transmission happens with direct contact with infected respiratory secretions. People can be carriers, and they will have the bacteria present, but they won't actually be ill. Risk are children younger than 2 or adults older than 65, and pre-existing conditions weaken the immune system. Chronic lung diseases also put you at a greater risk. Examples of this are COPD, which include emphysema. Another example is asthma and cystic fibrosis. Symptoms are chest pain, productive cough, hacking cough, fever and chills, sputum production, dyspnea, which is shortness of breath, tachypnea and tachycardia. Tachypnea is increased respiratory rate, while tachycardia is increased heart rate. Hypoxia, which is low blood oxygen levels, and weakness or general fatigue. Some of the pathological changes you're going to see with pneumococcal pneumonia are alveoli, inflammation, consolidation, and atelectasis. The alveoli are the air exchange areas of the lung. Atelectasis is, collapse of those air exchange, collapsing of the alveoli. Consolidation occurs. It's when the air that is usually in the lungs is replaced with something else, such as blood or fluid. Chest X-ray is going to show increased density. Air bronchograms or pleural effusions. Pleural effusions is where fluid gets into the pleural area, which is outside of the lungs. Chest assessment, this is when you listen with your stethoscope, and you're either going to hear crackles or rhonchi, which is a type of breath sound opposed to clear breath sounds. This can indicate that there's secretions or fluid within the lungs. Decreased PaO2, which is decreased blood oxygen level. You can get a measurement of PaO2 by doing an arterial blood gas. That's when blood is taken from an artery, which is a little bit different from what most people think of when blood is given. Most of the time when you give blood, it's a venous blood gas, or it's taken from a vein, which the reason it's done by an artery in this case is so we can see the oxygen level of the blood. And the reason it's taken from an artery is that's blood that's being pumped from the heart, which is still oxygenated, where venous blood is returning to the heart and it's already kind of gotten rid of that oxygen. And the test to detect Streptococcus pneumonia as the cause of community-acquired pneumonia is a urinary antigen test. And what that does is this test detects the C polysaccharide antigen of the bacteria. Treatment for pneumococcal pneumonia include antibiotics, which are used to treat the infected bacteria. Penicillins such as amoxicillin are commonly used to treat pneumonia caused by Streptococcus pneumonia. Oxygen therapy, which is supplemental oxygen, can be supplied to treat low blood oxygen levels. Most commonly, you're going to see nasal cannulas used. However, you can see patients on aerosol masks. A little bit of a step above this would be high flow humidified oxygen. This is also a nasal cannula. It's just there's the ability to have humidity, which is, it humidifies the airways, and then you can also run those at higher oxygen levels. Bronchopulmonary hygiene is another treatment used to mobilize secretions out of the lungs. Examples of this can be an incentive spirometer. Most of you are probably familiar with this. They give this to a lot of patients after surgery. It's a device where you suck in and a slow, deep breath. It helps expand the lungs, helps recruit the alveoli. Chest physical therapy, postural drainage, percussion, and vibration. These are all methods to help mobilize those secretions out of the lungs. Postural drainage is where you put patients in different positions to help move those secretions from different areas and different lobes of the lungs. The CPT, or the chest physical therapy, is where you actually beat on the lungs with your hands, where you can use something as a vest, which is vibration, and that helps mobilize those secretions out. Mucolytic therapy can also be used. That's a nebulized drug such as Mucomist, which helps break down the secretions and help get those out of the lungs, mobilize those out of the lungs. Lung expansion therapy is another treatment for pneumococcal pneumonia. This is used to address the atelectasis, like we were talking, the incentive spirometer. And what we look for is when they take in that deep breath, it's measuring your vital capacity, and we look for 10 milliliters per kilogram of the patient's weight. Intermittent positive pressure breathing, most commonly a device called an EasyPap is used with this, and with an EasyPap you blow against an airflow that creates a back pressure in the lungs and helps expand the lungs and helps recruit those alveoli. Continuous positive airway pressure, or CPAP, most people are pretty familiar with this. The constant positive airway pressure, and that opens up the airways and opens up those lungs. Sometimes non-invasive ventilation and mechanical ventilation can be used. That's if the patient is not ventilating effectively enough and a machine has to be used to help assist that. Here are some examples of the devices we just talked about. This is the incentive spirometer. This is the one where you take in the slow, deep breath and your vital capacity is measured. This is the EasyPap. That's the device that you blow against an airflow and it creates back pressure in the lungs, helps open and expand the airways. This would be an example of this could be a CPAP or a BiPAP machine. That's the CPAP creates a continued positive airway pressure, where the BiPAP actually creates two different pressures, and a respiratory rate can also be included to help the patient. It's a little bit more assistance than the CPAP. This would be a ventilator, and this is an example of a patient. To be put on the ventilator, you have to be intubated with an endotracheal tube placed in your trachea. Another disease caused by Streptococcus pneumonia is bacterial meningitis. Meningitis is inflammation of the protective membranes that surround the brain and spinal cords. Risk factors are babies, areas with large groups such as college campuses, medical conditions that weaken the immune system, traveling to areas with large populations of people infected with meningitis. Bacterial meningitis are generally spread from person to person, with the kind caused by Streptococcus pneumonia being spread by aerosol drops when people cough and sneeze. Signs are fever, headache, stiff neck, nausea, vomiting, and if the disease progresses enough, the patient can experience convulsions, coma, and death. Diagnosis is blood or cerebrospinal fluid collection. Treatment: for bacterial meningitis is antibiotics, and the prevention for meningitis caused by Streptococcus pneumoniae are pneumococcal vaccines, which are also one of the prevention methods for the pneumococcal pneumonia. Acute otitis media is another disease that can be caused by Streptococcus pneumonia and is also known as a middle ear infection. Symptoms are ear pain, fever, and irritability. Transmission is from person to person through respiratory droplets when people cough or sneeze, and children are more at risk for ear infections than adults. Treatments for this are antibiotics, but they're only used when the immune system can't fight the infection alone. And prevention is once again the pneumococcal vaccine. Bacteremia is another disease that can be caused by Streptococcus pneumonia, and it's the presence of bacteria in the blood. Symptoms are fever, hypotension, and altered mental status. Risk factors include a weakened immune system, older patients, and hospitalized patients. Transmission are bacteria from localized infection enters the bloodstream. Diagnosis are blood tests to show the presence of bacteria and the gram stain to determine the type of bacteria causing the infection in the blood. Treatment is broad spectrum antibiotics before the gram stain is finalized, so it can treat either gram negative or gram positive, and vancomycin for the gram positive bacteria. And it's very important to start the antibiotic therapy as quickly as possible if bacteremia is suspected. Since the introduction of the conjugate vaccine in 2000, pneumococcal disease has declined in both adults and children. Before the year 2000, pneumococcal infection caused 60,000 cases of invasive disease, with 40% being resistant to at least one antibiotic. These numbers have since decreased pretty significantly after the pneumococcal vaccine in 2000. One way to help prevent the antibiotic resistance is to prevent the overuse of antibiotics, the underuse of vaccines, and then developing new vaccines that can help control antibiotic resistance. That is the end of my presentation. I want to thank all of you for taking the time to see it, and I hope you guys all have a great day. Thanks.